Hi, so I'm going to be talking to you today about alternative feeding methods. So whether or not that is feeding with expressed breast milk or feeding with formula milk or supplement milk, these methods work really well. A lot of the time, if you're going to talk to a family about, well, okay, so if you're not feeding directly from the breast, what is the option? They will almost certainly say, well, bottle feeding. But actually, there are some options available to you. And these options are really, really good if you are also hoping to establish breastfeeding. We know that the suck swallow pattern is quite different if a baby is drinking from a bottle. So if for any reason there's some kind of temporary interruption with the way that the breastfeeding is going, then we can look at alternative methods to hopefully support you and your baby to move towards direct feeding. So the very, very early days, we have very small amounts of breast milk, colostrum. It's a really high calorie product for your baby, and it coats the lining of the intestine, and it's often referred to as liquid gold. It's totally impossible to replicate within any kind of manufacturing environment. So it's really, really small amounts, which is perfectly suitable for the size of your baby's stomach. So if you are able to collect some of that colostrum in those early hours and days, you can do that by syringe. So you're going to be collecting it into a really small, this is a 1 milliliter oral syringe. You can get these from your midwife, or you can get these from Amazon. And this is a 1 milliliter syringe. And you can, if you're expressing your breast milk, you can express the breast milk, so you're pressing on the milk ducts and then you're using the syringe and you're sucking up or you're scooping the breast milk that you express. Okay, so we've got some lovely breast milk, lovely colostrum in our syringe. And we're like, okay, right, well, the baby's hungry and for whatever reason, we're not able to direct breastfeed, or we just want to give a little bit of a dessert or a top up, and so we can give this milk by the syringe. So we're going to take our baby and we are just going to pop the syringe in the corner of their mouth, okay? And so the syringe goes into the cheek, so it's kind of landing sort of here. We don't want it to be pointing directly back into the throat, because if we then depress the plunger, we don't want it to spray and hit to the back of the throat. So we're going to use it very slowly, maybe like 0.2 of a mil at a time. So that's 0.2 of a mil there. So maybe that sort of amount. We're going to depress the plunger very gently into the corner of the baby's mouth. And we give the baby time to suck and swallow and taste and enjoy that breast milk. The other option that we have when volumes start to increase is cup feeding. Now, cup feeding I think is amazing, and it is something that I think can be really, really empowering for parents. It's often something that we're using if breastfeeding hasn't quite gone to plan, but the volumes are starting to increase, but we need to get calories into that baby for whatever reason. So we're needing to offer some slightly more greater volumes than we would do by syringe, and we can do that by cup. And so if we use the cup, then we don't introduce the confusion of a bottle. So with cup feeding, we're either collecting expressed breast milk directly into the cup, so we can express and we can kind of scoop a little bit, or we can, if we've been able to pump a little bit, we can give milk by cup, or we can of course give supplement milk by cup. And so when we're cup feeding, we're holding baby nice and securely, and we're offering the milk just at the lip of the cup. We're never pouring it into the baby's mouth. We're just sitting it at the lip, and we're allowing the baby to lap the milk up with their tongue, much like a cat would lap milk from a saucer, or we allow them to sort of slurp it into their mouth. So we never pour it into their mouth. There's more detailed videos that I can give you about cup feeding, but I just want to give you a real high level overview on your options. So that's cup feeding. Obviously, you've then got bottle feeding. So I really like a teat with a graduated teat rather than one that is, so you see the difference between these two. So you've got this one that's really pinched at the end, and this one's more graduated. So I really like this type of bottle. because it enables a really wide, the baby to keep that really wide latch on the bottle. So if you are for any reason having to use a bottle as well, then this I feel like is a good option, a graduated teat. And with this, we're always offering in a paced feeding environment. So our baby is upright, the bottle is upright. So when we're first offering the bottle, we offer an empty teat. Now, those of us that were born in the 80s and 90s were probably, panic instilled by our mothers about air going into babies, but it's not a concern. If we allow our baby to control the feed, to pace the feed, then the air is not going to cause a problem. Okay, and we're obviously going to burp our baby when we are bottle feeding our baby. So we offer the baby the bottle, we give them the chance to have 5-6 sucks with nothing in there, and then we bring the bottle up to horizontal and we allow the baby to take the bottle in the horizontal position. So we're never bringing the bottle like this and causing sort of downwards pressure, and really the baby can do nothing other than suck and take in the milk at this stage. So we're offering the bottle in this horizontal position, so your baby's got complete control. There's another feeding method that in the UK we really don't talk about very much, and it's some sort of tube feeding. So you can get these really, really fine tubes, and there are commercial products on the market, something like this, a supplementary nursing system, that you can purchase, or you can just buy a thin gauge nasogastric tube, so the type of tube that goes up into the nose and down into the stomach of a person. But you're going to use that. You can use that for what's called finger feeding, or you can also use it for supplementing at the breast. So this bottle would be filled with some kind of milk, whether that's express breast milk or supplement milk. So this has got your fluid in, and this is inverted, and so some of them you can just sort of clip to a bra. Others of them are soft bottles and you can squeeze them a little bit. And so if we're finger feeding, what we're going to do is we're going to place, if you've got a nice short nail, you're going to place the tube just on your finger, and you're going to offer the baby the opportunity to take the finger into their mouth and draw the tube in as well, and they'll be able to receive their supplement milk in that way with the tube going down the finger. The other option for you is using this kind of supplementary system is for the tube to be placed on the breast. Okay, so we can tape the tube just onto the breast. You obviously want to be high enough for the baby to be able to get a nice deep latch as well. And so you can take the tube on then. And so if there's any reason why you're having to either supplement your baby or provide an additional top up, or just wanting to have the bonding experience of breastfeeding your baby, even if you don't have some kind of supply, or maybe chest feeding your baby if you're transgender, then so you can use a supplementary nursing system. You have this tiny little tube, you tape it to your breast, and then your baby latches on in a normal way onto the breast and to the tube. It'll be going into their mouth, and they'll be taking their milk like that. Sometimes it can be a little bit fiddly if you've already got what we refer to as SNS, a supplementary nursing system tube in place. So sometimes a parent might prefer to latch their baby onto the breast and then gently introduce the tube at the corner of the mouth to get the baby to take the supplementary milk from there. And it can take a little bit of fiddling with a system, a supplementary nursing system, because there might be, you might need to adjust the flow of the milk. So like this one's got a little clamp on it. You can have softer silicone bottles that you sort of sit next to you and you can squeeze them to help with the pressure. So they can be a little bit awkward, a little bit fiddly, but if there is some kind of challenge with feeding, then a bottle is not your only option. There are choices out there. And my sort of very first port of call when you are going from, volumes that are greater than colostrum would be a cup. And every single postnatal ward should be able to provide you with a cup to feed your baby, whether or not that is with formula or with expressed breast milk that you've expressed yourself. So cup feeding is an excellent option to consider for the future. Not for the future. Cup feeding is an excellent option to consider for feeding your baby if we don't want to disturb that suck-swallow pattern that we're going to get from a bottle. I wish you all the best. This was supposed to be a really short overview of alternative feeding methods. It's 10 minutes long, so I apologise for that. Reach out if you have any questions.